Hey everyone, today I'm going to give you some tips and tricks on urinary tract infection prevention. The first tip and trick is to drink plenty of water. Water is going to dilute your urine, and it's also going to help you go to the bathroom more frequently, which is going to flush out all of that bacteria, so then you have a less likely chance of getting an infection. Tip and trick number 2 is to always wash your hands. Especially because you have no idea what you're wheeling on top of, and your hands are constantly touching your wheels when you're pushing around. And if you don't wash your hands, then that bacteria is going to get into your bladder a lot easier if you use a catheter. Your home setting is going to be a lot cleaner than a public setting. So what I use when I go to a public setting is I have this closed catheter kit. Here's the actual catheter system. It's all pre-lubed inside. And then I use these 2 latex-free gloves because if I wash my hands in the bathroom, okay, sure, they're clean, but then when I wheel to the stall, oh, I need to touch this. Oh, also comes with this little pad, a cleansing pad, and povidone iodine swab sticks. But I only use the bag catheter and the gloves. Tip number 3 is to have a healthy diet and exercise. That's going to help boost your immune system, and that'll help you fight off infections. Tip number 4 is to eat cranberries or drink cranberry juice. This is very acidic and it's not friendly towards bacteria, so it's going to help you prevent getting a urinary tract infection. And what researchers now believe to be the case with cranberries is that it prevents bacteria from sticking to the urinary tract walls. So these 4 tips and tricks aren't going to 100% guarantee that you're not going to get a urinary tract infection, but it's definitely going to decrease the chances of you getting one. So in case you do have some symptoms that include urine that has a lot of sediment in it, urine that has mucus, urine that has kind of a funky smell to it, or it's cloudy, or if you're not feeling good overall, maybe check and see, go to the hospital and just do a urine sample, and they could tell you if there is a urinary tract infection. If you notice any of these symptoms, you're going to want to cut back on alcohol, caffeine, and sugar. Drink more water, and if you use a catheter, cath more frequently. I hope you found these tips and tricks to be helpful, and hopefully you don't run into the problem of having a urinary tract infection, but it's bound to happen just because if you're cathing, you're constantly putting something into your body, and you're not going to have your hands clean 100% of the time, and it just happens. It doesn't happen just to people with spinal cord injuries. It happens to people that don't have spinal cord injuries, but if you have a spinal cord injury or are a wheelchair user that caths, you're going to have a higher risk of having a urinary tract infection. But if you follow these tips and tricks and other tips and tricks and go see your doctor if you feel like you have an infection happening and they do a test for you, that is going to help you in the long run, because if you don't do something right away, it could have a permanent effect on your bladder that could create scars. So yeah, hopefully these tips and tricks help you guys down the road. And yeah, drink lots of water and have a good one.